Good morning. And I am delighted to again say welcome to the second annual Gun Prevention Forum. I'm delighted that you're all here again. I believe that we actually have about 1,200 people registered for today. And I want to say thank you to begin for your interest, your concern, your compassion about this issue. I also want to say at the very beginning, a special thanks to the speakers, the panelists, the moderators, and of course, all of the staff that have done such good work to make this day happen, even though it is different than last year. Last year, we were all together in a large room, so we could communicate absolutely directly in person. But given the times we were in, this is the forum we have to do it today. But it doesn't hinder any of the progress that we plan to make or the discussion that we're about to have. So I would say that today we have a community of interest. We have caring individuals, concerned individuals, and leaders coming together for the purpose of enhancing the dialogue, building upon the discussion from last year, sharing information, sharing good ideas, coming up with innovative ways for how we can make change happen, and to elevate the discussion, continue to elevate the discussion that gun violence is a national emergency and a major, major public health issue. And that's important. This is a public health issue. Over 100 people a day die from gunshot wounds, 100 people a day, including today. So this is an issue that we have to continue to elevate, even in the midst of a pandemic that we're going through right now. We should not step aside and say just because we have so many other things going on, which we have to address and which we are addressing successfully, and we will succeed in dealing with COVID, that we also have to make sure that the other major emergency we have, in our view, is the pandemic of gun violence. So since last year, I know that progress was made. We've moved forward. I hear about some of the great things that have been happening around the country, even in a time like this. So here at Northwell, for example, since last year, we created the Center for Gun Violence inside our health system. We created a steering group, a collaborative group of other health systems and other hospitals from across the country. We've had some of the major entities around the United States collaborating with us or committing to collaborate with us as we go forward, and that's a very, very, very positive sign. We also, since last year, we received a grant from the NIH to actually provide information and ask questions of all patients that come into the emergency department, questions about firearms in the home. And we will be doing a study on this. This is a research project, a major research project, one of the first of its kind in the United States. You're going to hear more about this later. So progress has been made, but there is so much more to do. And it takes people like all of you and all of the speakers today to continue to accelerate it. Talk to your friends, talk to your neighbors, talk to your politicians. This is not a Second Amendment issue. This is about making sure that we provide prevention and protection and have safe gun laws. Educate people more, and provide avenues for people can actually work together in a consolidated, innovative, creative way. So while progress is being made, much, much more needs to be done. And today, we will continue to talk about this.